When I came here, I know that Mayo Clinic was one of the best hospital in the world. And after taking some research about Mayo Clinic school, it was really impressed me. A lot of things that I can learn. Maybe I can move on in the future education.
The histology technician program is a 9-month training program embedded right into the heart of Mayo Clinic, and we do work that prepares microscope slides. We think of it as kind of an art and a science because we are looking at things that are going to be used to make a diagnosis. So we have to have an understanding of the human body, the anatomy and how it works. So there is a science to it, but then we also think of it as an art because there's a lot of technique and a lot of hands-on work that goes into it. And it's not all black and white. It often requires some nuances that are learned on the job to actually prepare these beautiful works of art that we look at microscopically when they're complete.
So my favorite part of the histology program would be just kind of the whole learning aspect of it. It's kind of a hybrid sort of program where you have some online stuff, which is nice because you can kind of sit at home and do your schoolwork there. Then there's also that hands-on training with lab staff. So you get a lot of hands-on training, which really helps solidify that learning.
We have 2 other campuses, so the Arizona and the Florida, and with those students we were able to come together during the didactic portion of our program, and that was super nice because we got to have a little in on their perspectives, and they're obviously from different states, so we got to talk to them, and it was kind of fun talking to them about the weather there and the differences in their labs and how they're set up.
It's really interesting actually to bring them all together because while the work we do is very much the same, the procedures and processes within each institution is a little different, and so it helps students expand their knowledge about how things are occurring on different campuses and gives people different perspectives. So that virtual environment really gives us the opportunity to bring us together, even though we're thousands of miles apart, to have that interaction and learn from each other.
So what I like about the virtual classroom, partially because you don't have to leave your house, you can just do it from there. It also kind of makes things a little less stressful. You don't have a bunch of people. You can just kind of think through things a little more. They give you a little more time to ask questions.
My favorite aspect of histologist program is the hands-on experience while studying, not just only reading the book or watching the videos on Blackboard, but I have a chance to work in doing hands-on experience, working with patient tissues and working with awesome professional technicians in the lab. It gives me a lot of chance to understand more what will doing in the future. And yeah, it's really fun to me, and I love working with the tissues.
Our faculty are really grounded in the principles and how Mayo Clinic views our patients. The needs of the patients come first, and that's really carried over to our students as well. So in all aspects of slide preparation, we're looking at different checkpoints to make sure that patient care is taken care of. We don't get to see patients face to face, but we see pieces of patients that come through in the form of tissue that's going to ultimately be prepared into a slide. And so when we are doing that work, we're making sure that we're thinking about the patient as it's coming through and how is the work we're doing going to impact that diagnosis that could ultimately result in a treatment option for them. So our faculty are always looking at the quality of the work they're doing at each step of the process in slide preparation. And it's important that the students recognize that they can recognize flaws in their work, that they can troubleshoot, figure out what their next step is to make it a better product if there is an issue. And that's really embedded into all of our curricular pieces that we provide for the students.
Being a learner, I think inside of the hands-on experience, I feel really impressed about my instructors. They are really super helpful and nice. They will give me a lot of feedbacks about how my study progress. If I got some mistakes, they will spend time explain pretty clearly about that.
Well, if you're on the fence, I would definitely say come to Mayo Clinic because, again, there's just like different opportunities that you would not get at other campuses.
Advice that I would give to an incoming student is to definitely not work more than part-time because it's a pretty intensive 9-month program. There's a lot of information to learn. Make sure to study a lot, but by the time you get through the program, you'll feel pretty comfortable with doing the board exams. A good reason to come to the Mayo Clinic School would be that after you're done with the program and done with your board exams, you're almost assured a position here at Mayo. There's plenty of jobs available, and they really like hiring students from the program.